watching Amka Kenya, and this is Amka Vibe Check. This conversation highlights Breastfeeding Week, and this theme is all around the ecosystem that helps women, have that proper support to be able to enact, that proper, breastfeeding fundamental, as I've mentioned. Right, so earlier on, we had asked you a question of the day that what can we do to support women better? And, like you can see on the question there, what is the single most impactful change that would better support breastfeeding mothers in your community or workplace? Let's take a look at what you have to say on the same matter here. I want to highlight your feedback there, and that is Ruth Chepkemoi from Kericho, who says government clinics should provide better follow-up support for new mothers after birth. Okay, thank you so much, Ruth. Diana Wanja from Meru says normalize breastfeeding in public without shame. Start with awareness campaigns. Man, it is 2025. Yeah. And well, there you go. That is your feedback. Thank you so much for telling us what you think, and keep them coming. Esther here will be able to give them more insight and perspective. Now, Esther, as you can see, there's so many, perspectives on what this support can look like. But let me begin with a few questions here and there. Yeah. So for some new moms, like you said rightfully, there's some injuries that can occur when you've not latched the baby on properly. And you can be so sore. I've been a victim of that, to be honest. And it's so painful, especially you have to keep alternating, like putting the baby on one breast or the other so that you can be comfortable at the end of the day. What is advisable in terms of getting yourself to heal faster in the moment or case that happens?
So the first thing is work on that latch. Make sure that your nipple is going further in, the way we're saying, further in into the mouth, so that it gets away from the baby's gums. Because the baby's, once it's on the baby's gums, the baby will continue to cause trauma on it.
I think the question is, before you can even continue, is they are toothless.
Yes. Yes,
but they can cause you so much.
The gums are really hard. I mean, I keep saying an example, like even grandmas that have lost their teeth can eat meat. So gums are really hard. Gums have a lot of strength. So you want the gums to be on the dark part, because that part is not as sensitive. The nipple is very sensitive. And also it means that when the baby's gums are on the nipple, the baby is compressing the outlet of the milk. Remember, the milk ducts are converge on the areola. The nipple is just an outlet. So it's like trying to pull milk from a straw. So you want the gums here so that the milk can flow through the outlet of the nipple. So the first thing that we do when someone has sore or cracked nipples is work on the latch, because then it means that there's no more trauma on the nipple. But to help them heal, nature has given you the best gift to help you heal. Express a bit of the milk and apply it around the cracked nipples, let it dry, perfect.
And there you go.
And there you go, it helps you heal. Coconut oil is also a good, can heal. Ghee is another good remedy. So these are simple, home remedies that you can have.
Your body is
providing, exactly. So you can use that and it will heal as long as you're working on the latch to make sure that the nipple is away from the baby's gums.
Okay. Another very crucial factor is, and some people have called this vein, but for some women this is so traumatic for them because, like you said, they don't have proper information. And others, well, people have termed them, like I said, selfish. They do not want to breastfeed because they say their breasts rather will sag, and they cannot deal with the aftermath of not being able to look at themselves and not being able to recognize themselves.
I love that question, because guess what? It's not breastfeeding that makes boobs to sag. It is pregnancy. It is not breastfeeding. So during pregnancy, the hormones that help everything to just loosen up, to allow the baby to, to be born. And that hormone is called relaxin. So it relaxes everything, including your breasts. So as long as you've gotten pregnant, your breast shall change. But that said, it's important during breastfeeding to support your breast well. Wearing a good, well-fitting bra that does not have an underwire, because if it has an underwire, it might cause some blockages, but supporting it well, because they become heavier with milk. But with good support, your breast really won't change that much. It's the pregnancy, it's not breastfeeding. So if that's a reason that affects you, talk to someone, and we're able to help you figure out how to get good support so that you can breastfeed your baby. Yeah, yeah.
Okay, and for some women, they've already undergone plastic surgery before, you know, giving birth. So the concern is, will they still be able to produce?
To breastfeed.
Yes, or
so
produce milk with
implants. It really
implants.
depends, and I love that question. For anyone who has not breastfed or is planning to in the future, and you're doing plastic surgery, it's good to talk to your surgeon, because it depends on where the incisions were made, where the scar tissue has formed. If you are having a nipple replacement, that might be hard, because then there'll be scar tissue around the nipple, and then the milk won't be able to pass through. But nowadays, plastic surgery is being done in a way that moms can still breastfeed, depending on what the surgery was about. Yeah. So, but if you already have it, you need to maybe do a scan before, or an ultrasound, to see, do you still have ducts that will produce milk? Will the milk be able to pass through? Because we've had some moms who've had plastic surgery, and then when they give birth, the milk cannot flow through. So we need to dry up that milk, because then she can get sick with infections, because there's nowhere for the milk to go.
Right. Now, I've heard some doctors say, even others who've come and said, the extreme cases where you'll find some women give birth, so they'll sign themselves in for, you know, cesarean section, delivery, and after that, they will almost immediately have the mommy makeover. You know, right? So you're having a mommy makeover. You're in pain. It's a C-section. You have to, like, just hold the baby as you are. Your back is weak, and you know, and the like. So there's a lot of pressure to still look okay, you know, because, like I said, it's a societal issue. It's not per se just a second nature for some women. What would you like to say about that, or what would you say about that?
I would tell women to be kind to themselves. And kind to themselves, to know that what do you feel, if that's important to you, you can still achieve that and still breastfeed your baby, because there's also a lot of mom guilt when it comes to how moms feed their babies. And part of the support structure we are talking about is being able to talk through this before you have the baby. So if that's your priority, then how can we work together to make you comfortable to achieve your goals, but still be able to feed your baby? Maybe it's teaching you different positions so that you're comfortably healing as you breastfeed your baby. Like for C-section moms, there are positions that are more comfortable for you than for a mom who possibly had a physiological birth. So maybe lying down when breastfeeding, that's okay. Maybe side lying, maybe laid back, so they're comfortable and still continue feeding your baby as you work through your healing process. But also knowing that breastfeeding is actually one of the best ways to actually lose the pregnancy weight, because you burn a lot of calories, as long as you don't eat for 10, because in our culture.
That's another thing. That's another thing, because and before we even go on to eating or the zile uji na njaa zenye utaletewa, let's take a look at the first milk, sorry about that. The first milk that you get when
colostrum.
Colostrum. Speak about that.
Liquid gold, we call it. So colostrum starts off as light colored, because people see like it looks like water and they're like, I don't have milk. That's milk. The very first is watery.
Like, what is going on here?
What is going on here? Why do I have water leaking from my boobs, right? If you tasted it, and I told moms, taste it. It's really sweet. It gives your baby energy. But then it becomes this liquid, yellow, rich milk. That colostrum is pure gold. It's full of immunological properties. It's your baby's first vaccine. It helps the baby, anything that you've ever been exposed to, any germs you've ever been exposed to, it's got antibodies. And it's giving your baby that to start protecting them. It also has enzymes that help the baby start to learn, the baby's gut start to learn how to eat, digest, poop. it has a laxative effect. That's why in the first days, the babies poop all the time.
Yeah.
So it's teaching the baby that, you know, process of eating, digest, and out again. And then it also has properties that help to start sealing the baby's gut. When babies are born, their gut is what we call leaky, meaning if you gave that baby food, it would end up in their circulatory system. So it's helping this gut become fully closed so that later your baby can eat solids, preventing allergies. So it's this rich source of everything that your baby requires. And your baby doesn't even need much. Everyone gets shocked when I show them this, that your baby's tummy size at birth is that small. It's the size of a grape. So if you're squeezing your breast and you're seeing, you know, a little water, it's enough. You just need to put the baby on the breast. They're going to get enough. They just need about 10 ml, which is just, you know, 1 spoon of milk. So put the baby on, and then it will help the baby poop that black poop, you know, that black, sticky, gooey poop.
Man.
Yeah, I know. It is crazy. But then the baby is able to poop, and then it helps the baby actually start to digest food.
Got you. All right. Yeah. Now, let's take a look at what you said. The food, you know, and it's a very nurturing thing that our families, you know, do, relatives and the like, who brought for all the things food, that are supposed to make sure that you have a good milk production in your body, the uji, like I said, the beans, the jahe, the whatever, you know. But to some extent now, that causes some women to have extreme postpartum depression because let's say, God willing, you've been able to breastfeed exclusively for 6 months. Now you're done, and then your body is so heavy, you know, and for some they would argue that way it is good to make sure that you're, you know, of course you'd have to gain because you're eating to exclusively breastfeed, and even more than that, you know, for some even they go 2 years if they can. But women these days are having crazy psychological effects and trauma-based because they are so unaware and they're not strong to carry themselves after. What is your articulation on this? On that?
So first of all, it's, I would say, a misconception that eating more means more milk. What brings milk is the baby on the breast, baby, breast and brain. Feeding the baby on demand. Mtoto akitisha, unampa. When the baby gives you that rooting reflex and those cues, you feed them.
They want to fight sometimes.
Exactly. They just want to eat.
Yeah.
If they want to eat after 1 hour, you feed them. If they want to feed after 2 hours, you feed them. If they want to feed after 30 minutes. Because what that does, that sends a signal to your brain. We call it the 3 Bs, baby, breast, and brain.
Right.
It sends a signal to your brain that baby needs milk, and there are these 2 hormones in your brain that actually help the milk to be made in your breast. So as the more you feed your baby, it's a supply and demand chain. As you feed your baby, more milk is formed. So that's the key, number 1. So I find many people eating, but the baby is not coming to the breast. So they call me to tell me, I'm eating everything. I've added 5 kilos and I don't have milk. Then I'm like, okay, tell me how you feed the baby. They're like, oh, you know, I feed after 4 hours. When baby cries at night, I give them maybe supplementary milk, but I still don't have milk. I'm like, that's why we don't have milk. The way to make milk is baby on the breast. So that's number 1. And how long
should we, then I think that the thing is when you're timing it, because
yes, exactly.
they are having a time or hour or however long they do it.
Yes.
But it means that if the baby is not on the breast for long, and long is, how do you even quantify that?
The baby knows. When they are full, they'll get off.
Yeah.
They terminate the feed. So yes, you're not timing feeds, you're not scheduling feeds. You're just, especially the first 6 weeks, because that's when your milk is being established. So that's key. Put baby on the breast whenever, unlimited access to the breast.
Right.
That's how you make milk. That's why you find, even in areas where people don't eat much, the fact that they don't have food, they keep putting their babies on the breast. One time I went to a drought, like a place with drought, and this woman who had not eaten for days was walking around dripping milk because her baby did not have food, so the baby was just feeding. So she was literally, your body actually burns and breaks down to feed your baby.
Right.
Your baby is a priority. Then secondly, you don't need to eat. Look at this tummy size. Look at 2 weeks, your baby's tummy size is this. Do you really need to eat an extra plate to feed this? You don't.
But the,
so you
the
just
notion
need,
is culture.
It just need a little extra. Like if you usually eat 5 spoons of rice, now you eat 7, not 10. You know, just a bit extra. Then secondly, you need to drink for 2. So drinking a lot of fluids, enough. If you're feeling thirsty when you're breastfeeding, it means you're not drinking enough. So what I tell moms, ensure that you're not thirsty, because that helps you to ensure that you have enough fluid to make milk. Breast milk is about 70% water. So that's the medium that the body uses to make milk. So that's what you need to take more of. And porridge is not a drink. Porridge is a starch. So if you take 5 flasks of porridge, you will have, I am also a nutritionist, and one of the things that we want is healthy moms that are not overweight and obese after their breastfeeding journey. We want you to be able to maintain, actually, breastfeeding is meant to help you lose your pregnancy weight. So you're eating enough, eating a balanced diet from all the food groups so that you're healthy and you're strong.
And your uterus comes back.
Yes, because as your baby is feeding, one of the hormones that helps milk flow from the breast also contracts your uterus. And that uterus,
it's painful.
It's painful at the beginning, right? Yeah. But then with time, it goes back. But if you're eating too much, guess what your body says? Or maybe there's a drought coming, and we will need to feed the baby, so let's store all this food. So you just need a bit of extra calories. You don't need to eat for 2. You need to drink lots of clear fluids, from soups to maybe teas to smoothies. You know, those are really great. Water.
And how much, you know, for moms who'd want to articulate, because tea with milk.
Yes.
It's
and sugar. So that's a lot of calories, right? So you could alternate. You could take, you know, hot chocolate, for example, with just water. And then you don't have to take one thing all through, you know. So take some water now, take some soup later, take some hot chocolate, take a cup of, you know, porridge. But, you know, through the day, alternate and just taking lots of fluids. But eating a meal, when you eat your meal, you eat a balanced diet from all the food groups, and then you'll be okay. Because you're giving your baby milk that is from a good nutritional process, but also not overeating. Also, we encourage moms to have mild exercise. Don't just, take time off for yourself. Go have some exercise, do a walk, go back to your exercise regime so that you keep up how you feel, because how you feel creates more of that oxytocin, which is that hormone we are talking about that helps the milk to flow. So when you feel good about yourself, you actually help your milk to flow more.
But also the mood, it's so important.
Yes.
Most of the time, you're told to check yourself when you're breastfeeding, because that's communication, relation with your child. So how should that mood be?
So that's where some of the support structures we are talking about. So the family setup, supporting this mom, helping her, like babies are feeding all the time, but they do sleep sometimes. They do sleep for like 3 hours. So you can take the baby from them so that the mom can take a bit of sleep so that she doesn't feel like she's so sleepy. Then also creating that, making sure the meals are made, you know, so that she's eating. Good nutrition is important for your well-being. Having time off, little breaks, even if it's an hour, to take a walk. And then also really doing skin to skin. So skin to skin is baby's naked on your naked skin. Having skin to skin has been shown to have immense benefits for both mama and baby. It helps stabilize your mood, especially if you're feeling like really, really tired, you're feeling overwhelmed. Just take that baby, have them naked on you as they sleep, and you'll be amazed at how well you start to feel. Because you release oxytocin, which is actually a feel-good hormone, and that makes you feel better.
All right. And I just specifically want to go back into postpartum depression, because you can have moms feeling it even way before they give birth, and then it becomes extremely worse after, and they're not able to breastfeed at all, you know, or even release anything. They don't feel like themselves. What is your advice? What should they do?
Seek help. There is help for you, and there's a lot of I would say stigma related to mental health, and yet there is so much help in any hospital, whether government or private. There are resources for you when you feel like that, and most times it's either talk therapy or there is medication, and that makes you feel better so that you can be the best version of a mother that you can be for your baby. And once you get help, then you find, I've had moms who thought they didn't want to breastfeed, but with good help they actually discover, oh, this is helpful. Breastfeeding is actually making me feel more empowered. It's making me heal. So that's one of the things that we say, removing the stigma from how a mom feels so that she can actually get treatment and be able to recover and take care of her baby.
Right. Yeah. And this whole aspect of some fathers or men do not know what to do when it comes to even holding a child to bring to, you know, their partners or wives and the like, because they say the baby is too small. So and they're like, how can they best support their wives or partners?
So I tell dads that take the things of mama, like burping, you know, burping the baby. This baby belongs to both of you, and this baby needs to bond with both of you. So papa can burp, can change diapers. You can ask the midwife at the hospital to show you. Right. You can get a doula to come home and show you. You can have your mom, or, you know, another. There are many parents in our midst. Yeah, you can have a dad, you know, who was very involved in their baby's life to show you. But learn how to burp the baby, learn how to hold the baby, learn how to, you know, soothe the baby to fall asleep, so that you can help your partner or your wife, so that they actually are able to concentrate on just breastfeeding and getting plenty of rest, and they also feel supported through the process. It's so important, because then baby bonds with you, and you'll find like that bond between the dad and the baby grows, because the dad is actually taking care of the baby themselves. Dads communicate a different message to a baby. They communicate security, while moms communicate nurturing. So your role is so important, because when you communicate security, you create very confident human beings in the future. Right. So it's really, 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 I do encourage dads to get involved in the process as well.
Okay. Yeah. We also need to highlight women who are HIV, you know, positive, and they are on medication. So of course we know that the disease doesn't have to get passed to the child when they are on continuous medication and the like. What can they do to ensure that that is
keep to aligned? The protocols that they've been given at the hospital, because they are monitored closely through the pregnancy and through the breastfeeding journey. You can safely breastfeed your baby as long as you're following your healthcare provider's instructions and protocols that you're given. But yes, very, very possible to breastfeed even if you're HIV positive.
Okay. Yes. And as we wind up, like I said at the beginning of this conversation, this year's theme for, you know, breastfeeding basically encompasses the ecosystem. Yes. What does this ecosystem ideally, like, what is it supposed to look like? And if you don't have the ideal ecosystem, what are you supposed to, you know, acknowledge?
So this ecosystem looks at right from pregnancy to the healthcare worker, to the family, to the employer, to churches and mosques, and anyone that interacts in the public spaces. Having spaces where moms can go and breastfeed or express milk. So it involves the whole community, the whole of the Kenyan community to support the mom. And when we support that one mom, we are ensuring that this mom has, this baby grows to have a great future, because then they've been breastfed exclusively and continued on to 2 years, which has been shown to show great benefits for the future of that child.
Got you.
Yeah.
All right. Thank you so much, Esther. We appreciate you coming. Your
Thank you for
demonstration, the little dummy baby boy. Thank you so much for your effort in illustrating this for us. We appreciate it.
Thank you so much for having me.
You're welcome. My guest this morning has been Esther Kimani. She's a doula and lactation specialist. She's, of course, speaking about the highlight of this week, which is Breastfeeding Week. We hope that you've gotten the information that you need. Coming up shortly is Tony Miriki with 10 Talks. But before that, we're looking at sport highlights with Terry Ivy. Do stay with us.